I've had pretty much 100 symptoms, maybe more. And going to the doctor, I would explain to them, or going to the emergency room, I would explain to them the types of symptoms that I would have. And they would test that part of the body or do some blood work on that specific part of the body to see if anything's actually going on. And everything would come back clear. Most of the time, actually, in the past when I was recovering, and I would listen to Miguel tell me, yeah, I actually had that symptom too, it actually gave me more comfort and reassurance rather than scare me that something was terribly wrong. Hey there, how's it going? My name is Coach Junior with CFS Recovery, and in this video, we're going to be talking about the types of symptoms that the nervous system can possibly give you. Now, quick disclaimer here, I am not a doctor, I am not a medical professional by any means. This is just somebody who is fully recovered coming to you and telling you about my experience in hopes that it can help you. Now, when I'm talking about the types of symptoms that the nervous system can give you, here's what I mean by that. Is that I've had pretty much 100 symptoms, maybe more. And going to the doctor, I would explain to them, or going to the emergency room, I would explain to them the types of symptoms that I would have. And they would test that part of the body or do some blood work on that specific part of the body to see if anything's actually going on. And everything would come back clear. I would still be experiencing the symptom in whatever part of the body that was, but a huge indicator that it actually was my nervous system and not something wrong with my body is because the test would come back clear. Now, here are some examples. I want to show you guys how many symptoms I actually had and my nervous system gave me, because I'm not trying to instill fear in you, but most of the time actually in the past when I was recovering and I would listen to Miguel tell me, yeah, I actually had that symptom too, it actually gave me more comfort and reassurance rather than scare me that something was terribly wrong. It just gave me some comfort knowing that somebody else had gone through something that I thought only I had, right? And we'll start from the top and go all the way down. So I'll start with like the head, and then we'll go to the neck area, the shoulder area, kind of the front, the back, the midsection, and then the legs. And then some of the more weirder symptoms that my nervous system decided to give me. And if any of these apply to you, and you've already been to the doctors and you've got all your tested and you've been cleared out, just understand that this is something that I went through as well, and it's something that the nervous system is more than capable of giving you. So let's kind of talk about the head area. And I think when we're talking about the head, the most common thing that I hear is head aches, right? I had a lot of headaches. I had a lot of migraines. Now, if we're talking about like in and like around the head, sometimes I would have headaches on only one side of my head. Sometimes it would only be the front of my head. And sometimes it would be the back of my head. I would sometimes also feel like if somebody were to tie a tight rubber band around my head too, really tight, that was also something that I experienced. I experienced a lot of dryness on my scalp, specifically in the form of what looked like to be eczema flares. So like really dry, really itchy scalp was actually one of my symptoms, believe it or not. I had a lot of head pressure. So it felt like somebody was literally pushing against my head like this. It wasn't the most comfortable thing, but it was different than the rubber band wrapped around my whole head. It was like a head pressure. Also, I had a lot of brain fog too, especially in the beginning. It didn't last throughout the entirety of the recovery, but I do remember in the very beginning of my condition, I experienced a lot of brain fog, a lot of memory problems, a lot of inability to think clearly and comprehend information in a very clear way. And now, if we move a little bit lower, especially to the eyes, I had a lot of disorientation with the eyes at points. I had floaters as well. If you guys ever see those little floaters go through your eyes, I also had what I defined almost like as a white glaze over my eyes. If somebody were to put like a very subtle film over my eyes, I noticed that too. Like, you know, when you wake up in the morning and you have that film over your eyes and all you have to do is just wipe your eyes a little bit and then it goes away. That's something that I had, except it didn't go away. after I wipe my eyes. Something else about my eyes too, bloodshot eyes. Really red bloodshot eyes was actually a rotating symptom of mine, as well as really dry eyes. That's something that I experienced too. Now with the eyes, let's kind of move over to the side of my head and talk about some of the symptoms that my nervous system gave me here. It gave me sometimes really dry inner ear canals that I had, a lot of ringing in my ears. You guys ever watch those war movies and you hear the grenade go off and it's like a really high-pitched ring and it drowns out everything else in the war movie? That was the sound that I had coming through my ears. So those were my ear symptoms. My ears were also really sensitive. This was a weird one that I actually sometimes forget that I had. My ears specifically would get really cold for whatever reason, and then they would actually fluctuate and get really, really hot, and it would like only be specifically my ears. Right? Now, if we move a little bit lower to the nose, I had sometimes dry nose and then I had sometimes really runny nose. And my dry nose would sometimes get so bad to the point where it would bleed and then it would, dry after that and crust up and then it would get scabby and itchy and really, really irritated. So that's something that my nose would do. I also felt a lot of sinus pressure in my nose too. One of my symptoms actually was a postnasal drip as well, where kind of like mucus goes down, the pathways down here, and it develops a dry cough like that. And sometimes I would have a dry cough for weeks and weeks and weeks without realizing what was happening. Dry cough was one of my rotating symptoms as well. If we go kind of lower into the mouth area, really dry mouth sometimes and really, really dry lips. I would also get really, really thirsty at times, and then it would actually switch other times where I just had no thirst at all and I had to force myself to drink water to keep myself hydrated. One of my rotating symptoms, I had a lot of like the white stuff on the tongue. I had to use my tongue scraper extra hard at points because that was one of my rotating symptoms. Really sensitive gums, as well as I used to have gums that would bleed after I would brush my teeth and I would spit. I would notice blood there too. Really sensitive enamel in my teeth as well. If I were to drink water, even that was a little bit cold, it felt like my enamel on my teeth was extra sensitive, along with my gums too. In the mouth area, also something that I would get quite commonly, especially during flare-ups or adjustment periods. And I don't hear enough people talking about this because maybe I'm part of a really small group that only gets it. I would get a lot of canker sores. Do you guys know what canker sores are? They're like white. It's almost like a cold sore, but it's like inside and it hurts really bad to speak. It hurts really bad when you eat as well. One of my biggest canker sores. And I had canker sores everywhere, like the bottom of my tongue, the side, on the back of my throat even, which then gave me the sensation of a sore throat a lot of the times. Sore throat, by the way, was one of my rotating symptoms too. Sore throat along with cold-like symptoms, fever-like symptoms, and flu-like symptoms I definitely had. Now, if we move kind of lower to the neck area, I would get like a lot of heat in my neck. I would get a lot of neck soreness and I would get a lot of neck stiffness as well in the neck area. Now, if we kind of move down to the shoulder area, I would feel a lot of pressure on my shoulders, like there was like weights like pushing down on my shoulders. I do remember that. I also remember a lot of joint pain, specifically in my shoulder area and in my elbow area too. So if you're experiencing that and got checked out and cleared by all your doctors, that could be a symptom too if you feel a lot of pressure on your shoulders. If we kind of move a little bit lower to this area here, right, where the lungs, the heart, the chest are, we can talk about the front and then we'll kind of move towards the back. So with the front, with the lungs, obviously I had shortness of breath, right? I had this feeling of air hunger, which was wild. And I'll tell you why it's wild, is that every time I checked my oxygen, it was totally fine, right? It was like anywhere from 97 to 99. Like I had more than enough oxygen, but I felt like I couldn't breathe, right? I had this sensation of shortness of breath. I remember going to the doctor, telling them that, and they're telling me, Junior, you're fine. You actually are getting a perfect amount of oxygen. I said, how is that possible? They told me it could be my nervous system. Well, they didn't actually 100% say that. They told me it could be anxiety, which we know now anxiety is still rooted in the nervous system, right? So essentially he told me it could be from my nervous system. So I had the shortness of breath, I had the air hunger, I had a feeling where somebody was like sitting on my chest. Like if you put like an immense amount of pressure or weight on my chest, it felt like someone was sitting on my chest as well. I had a lot of chest pain too. And conveniently and specifically, like it happened to be right where my heart was. Every time I went to the emergency room to get my heart checked out, because I've been so many times for my heart, it always came back normal. They said, Junior, your heart is perfectly healthy. It's totally fine. I just conveniently had the symptom of this pain, like right where my heart should be. Right now, when it came to my heart would beat fast. Obviously, I had a lot of heart palpitations. My heart would also swing the other way and beat quite slow as well. So I could sometimes go from almost 200 BPM and going down to 40 BPM. And that was actually the same with my blood pressure, believe it or not. I would go from having really, really high blood pressure to having really, really low blood pressure too, and that would fluctuate as well. So that was with the heart. My heart would actually flutter as well, and it would skip a couple beats. And it's funny, every time it would do that, I would cough for whatever reason. I would feel it go doo-doo, and then I would go like that. In the beginning, it would scare the crap out of me, but then eventually I knew that that was kind of normal and it was just one of my symptoms and I got used to it. Now, that's kind of the front of the chest. If we move back to like around the sides and the back, you know, where the intercostal muscles are. So this is kind of like the ribs and then kind of wrapping around the back here. I had a lot of pain, soreness, and stiffness around like the side of the ribs, the intercostal muscles, specifically the side where on my left side, if you were to wrap around this side and then going kind of back into like my upper back, that would actually be a symptom as well. It's the same symptom if, let's say, you get sick and then you develop a chronic cough for a few weeks. If you cough long enough, these intercostal muscles here around your ribs will start to get really sore because you're coughing so much, right? It was that almost same exact experience when I had those symptoms. Now, that was kind of the chest and then the back. If we move a little bit lower, some more things that I experienced, if we're moving into like the abdomen area and the gut area. Obviously, I had a lot of stomach aches. I had a lot of abdominal stuff. I had a lot of bloating after I ate as well. That was one of my symptoms, was like really big. I literally looked like I was pregnant, right? So I had a lot of bloating. There was a lot of gas. My stomach just went a lot of the time. So that wasn't pleasant too. Sometimes my stomach would feel like hard, like rock hard as well when it got bloated. So I do remember that. If we kind of move a little bit lower into the midsection, I had a lot of groin pains at times. When we're talking about groin as well, I had incontinence almost at some points where I would have to like go to the bathroom every 5 minutes because I couldn't stop peeing, and sometimes I actually couldn't control my pee. And I would also get symptoms mimicking a urinary tract infection, you know, where you pee and it burns as well. I've actually had that. Went to the urgent care, got tested for a UTI, completely clear. Nothing, right? But I had the symptom because it was burning when I was going to the bathroom. Now, if we're going to go to the back door, if you know what I'm talking about, going number 2, I had anything from diarrhea, switching all the way to constipation for sometimes days at a time. And then it would switch back to diarrhea, you know, all kinds of stuff coming out the back door. I don't want to get too much information about that. If you know, you know, right? Now, if we move a little bit lower to the legs, interestingly enough, one of my main symptoms was fatigue, and it was like fatigue specifically in the legs. I had fatigue all over, but I had like the most prominent fatigue in my legs, believe it or not. And it was my upper legs and then my calves. And if we kind of move down to my knees, I would have this joint cracking in my knees. So if I were to squat down, if I were to get up, my joints would crack, like as if my bones didn't have enough calcium. Obviously, I got all that tested and it was clear, but that was the first time that's ever happened to me in recovery, was my joints would do that. And then with my feet, the bottoms of my feet would get really, really hot, and then they would sweat, and then they would turn really, really cold. My feet would fall asleep a lot. My legs actually, just in general, would fall asleep a lot really, really easily. My legs would actually get cramps really, really easily too. Even if I were to just do something little, just even moving a little bit in the wrong way, and I would get cramps really, really quickly. I remember that was one of my symptoms. So off the top of my head, that's what I can remember. I probably had so many more, honestly, but that's just it goes to show how many symptoms the nervous system can actually give a person, and them going to the doctor for all of these symptoms, getting checked, and them finding nothing because it's the nervous system. Now, I'm not saying if you're experiencing the same symptoms that it's 100% your nervous system. Like I said, just like me, you have to go to the doctors, you guys, and you have to get it checked out before you can conclude or assume even that it is the nervous system. Go get checked first, right? Just don't assume first right off the bat that it's the nervous system. Because whilst these things mimic real conditions, if you haven't gotten checked by your doctor, there could be a possibility it is a real condition, right? So don't be dumb about it. Go to the doctors, get that checked out. And once you get that ruled out, then you can kind of work on accepting the fact that it could be the nervous system, okay? So I hope that gave you all some reassurance and maybe opened up your eyes a little bit to what the nervous system is actually capable of. Because when we hear of things like chronic fatigue syndrome, long COVID, fibromyalgia, we only think of things like fatigue and pain and maybe some brain fog, and that's it. We don't realize how deep this goes and how many symptoms our brains can actually give us on a real physiological level. It's really wild, right? So I hope this helps. Again, my name is Coach Junior, and post your comments below if you're experiencing any of the similar things that I went through and you've gotten checked out by your doctors. I'm curious to know, and I will see you guys next time.
Say that CFS recovery is absolutely the real deal.